Welcome to Next Chapter Living, where every page turns a new possibility.
Picture waking up in January with sunlight pouring in, and then realizing you're down to your last refill of a critical medication. Before you unpack the golf clubs and sandals, keeping your medical care steady has to come first. Do that right, and your move is peaceful. Let it slip, and a routine refill or a follow-up can become a full-blown emergency. Here's what I want you to walk away with today. A short, practical plan you can start before you leave. A set of scripts to use on the phone or in an email, and a 30-day checklist that keeps everything moving while you settle in. No theory, just things you can do tomorrow. Start before you box a single dish. Call your primary care, your specialists, and your pharmacy at least 30 days before your move. Why 30 days? Because records and imaging often take longer than you think, especially when CDs or secure portals are involved. Put together a one-page medication list, drug names, doses, reason you take each one, how often, and any allergies. Add your preferred pharmacy, the name and phone number of your current primary care doctor, and keep one printed copy in a portable health binder and one on your phone. Quick script you can read or paste into an email to the records department. Hello, my name is your full name. Please send an electronic copy of my medical records, medication list, and imaging reports to new doctor's name at new doctor's secure email or fax. My date of birth is mm/dd/YYYY. Thank you. Keep it short and put the receiving provider's contact info right in the message so there's no guesswork. Now, insurance, this is where people from the Northeast hit surprises. If you're on original Medicare, your coverage follows you, but update your address with Social Security and Medicare so claims route correctly. If you're on a Medicare Advantage plan, networks can change county by county, so ask whether your current specialists are in network where you're moving. When you call member services, say, I'm moving to new zip code. Will my current doctors be in network? Are any prior authorizations required for ongoing treatments? Can my mail-order prescriptions be transferred to my new address? Those exact questions cut straight to the issues that create gaps. In the first few days after you arrive, focus on 3 things that matter most. Connect with a primary care doctor, secure your prescriptions, and know where to go in an emergency. Schedule a primary care visit within the first 2 weeks, or at least set up a telehealth consult to introduce yourself and transfer care. Make an emergency information sheet to carry in your wallet. Name, emergency contact, allergies, current meds, primary doctor and phone, and insurance details. Find the nearest urgent care, the closest hospital with an ER, and identify 2 pharmacies in town that accept your insurance. And a practical tip, keep your medication bottles in your carry-on or a personal bag, so nothing gets lost in transit. Prescriptions deserve special attention. For most non-controlled meds, pharmacies will transfer a prescription with a quick call. Use this line with your old pharmacy. Hi, this is your name. I need to transfer my prescription for medication name, strength, to new pharmacy name, phone. Can you please send the remaining refills? Controlled medications are trickier. Depending on state rules, you may need a new written prescription from your previous doctor or from a new provider here. If you rely on controlled meds, plan a bridge. Ask your current doctor for a short supply and discuss options for an expedited appointment with a new physician once you arrive. I remember a client who landed here and found their cardiology notes hadn't arrived and a crucial refill was stalled. 3 days without the right paperwork meant needless stress. We resolved it with a telehealth consult and an overnighted script, but that extra worry was avoidable. When you sign a release for records, keep it concise and exact. I authorize, current clinic name, to release my complete medical record, including clinic notes, lab results, and imaging, to Dr. New provider name, at contact. Patient, your full name, DOB, month, day, year, signature, your signature or e-sign. Ask the records team how images will be sent. If they offer only CDs, request a secure portal link or emailed access instead. Digital is faster and keeps things moving. Finding the right providers here starts with hospital systems. Use hospital physician directories. Hospital-affiliated doctors often have smoother referral processes and clearer insurance verification. And don't underestimate telehealth for that first consult. It gets you on file, gets prescriptions moving, and buys time while you schedule in-person visits. Ask your realtor, community managers, or neighbors for trusted recommendations. People who help relocators have quick insight into reliable in-network options.
Okay, risks and quick fixes. Records delayed? Download what you can and carry a complete med list. Insurance network surprise? Call member services and document what they tell you. Specialist availability slow? Use telehealth and hospital referral lines to get on wait lists fast. That's a lot, I know, but these small steps prevent the big headaches.
Here's a short 30-day health handoff you can use today. 1. Request and download records and imaging. 2. Create a one-page meds and allergies sheet. 3. Call insurance and confirm networks. 4. Arrange temporary refills or mail order transfers. 5. Schedule a primary care appointment or telehealth visit within 2 weeks. 6. Identify nearest urgent care, ER, and 2 pharmacies. 7. Keep everything in a portable binder and an accessible digital folder. Follow those steps and you'll avoid most common headaches I see working with relocators. If you're thinking about relocating to Pasco County, Land O'Lakes, or the Tampa Bay area and want local guidance, whether it's where to find a reliable primary care doctor, which hospitals have the strongest referral networks, or how Medicare works here, I'd love to help. Visit the Next Chapter Living website to download the 30-day healthcare handoff checklist, see local resources, and request personalized relocation support. Thanks for listening. This is Matthew Troncone, wishing you a smooth move and steady health in your next chapter. Real conversations about relocating, downsizing, and living well.
Thank you for tuning in to Next Chapter Living. Join us again for more stories worth giving. Until next time, let your journey ignite. Live your best life and keep your dreams in sight.